This talk is about age and somatosensory evoked potentials. It is intended for the Nicklaus Children's Hospital Clinical Neurophysiology Fellows. It will be conducted using a question and answer format. First question. Peripheral nervous system myelination reaches adult level by age-years of age. A, 1 to 2, B, 3 to 4, C, 6 to 7, D, 9 to 10. Of the multiple factors that influence somatosensory evoked potentials, latency, amplitude, and morphology, age is an important one. Age-related factors are especially influential in the pediatric and elderly populations. The impact of age in pediatric somatosensory evoked potential is due to three factors: myelination, maturation, and growth. Myelination occurs at different pace in the peripheral nervous system, that is in nerves, plexus, and roots, than in central nervous system, that is in tracts, lemniscus, and radiations. The onset and progression of myelination has been studied by different methods in different species, and the onset and partial or full myelination of multiple structures in relation to postconceptional weeks, as postconceptional weeks was calculated in the old days, has been reported. Sensory roots are considered to start myelinating at 24 weeks and to be fully myelinated by 6 months corrected age. Cuneatus fascicle starts myelinating at 14 weeks and is fully myelinated by 1 month corrected age. The gracilis fascicle starts myelinating at 22 weeks and is fully myelinated by 4 months corrected age. The medial lemniscus starts myelinating by 23 weeks and is fully myelinated at 1 year corrected age. The thalamus starts myelinating at about 34 postconceptual weeks and reaches significant myelination by 2 to 3 month corrected age. The thalamocortical fibers start myelinating at 40 weeks postconceptual age and are fully myelinated by 2 years corrected age. Other studies have given a slight different myelination curves to thalamocortical fibers, which they call somatostatic radiations. They report the onset of myelination at 36 weeks postconceptual age and full myelination by 2 years corrected age. Optic radiations start myelinating at about 40 weeks and are fully myelinated by about 5 months corrected age. I like to stress at this point that all these patterns of myelination must be seen as a trend which, other than for timing of the caudate fascicle myelination, goes along with the tendency towards the peripheral nervous system maturing before the central nervous system, the brainstem myelinating before the brain, and finally the brain myelinating. Another age-related factor that influences somatosensory evoked potential is maturation. By maturation, I am referring to synaptic maturation. Synapses must be mature to trigger an action potential in the cell generating a traveling field, and in the case of stationary fields, the generation of fields is solely dependent on the presence of mature synapses. triggering an action potential in connection with other neurons. The third age-related factor that influences somatosensory evoked potential is linear growth. Linear growth goes hand in hand with axonal lengthening. Axonal lengthening is related to height and arm span. Growth involves primarily the limbs. The trunk also lengthens with age, but to a much lesser degree. Not surprisingly, all these somatosensory evoked potential influencing factors reach adult values at different ages. Nerve, referring to all peripheral structures, reach adult values between 2 and 5 years of age. Most authors would say between 3 to 4 years of age. Central nervous system pathways reach adult myelination values by 5 to 7 or 8 years of age. Synaptogenesis varies from structure to structure, but in general, peripheral nervous system synaptogenesis is advanced in relation to central nervous system synaptogenesis. Limb growth, and to a lesser degree trunk growth, occurs up to the age of 18 to 20 years of age. So the answer to this question is B. Next question. Which of the following adult posterior tibial nerve somatosensory evoked potential montages has been more often used to correlate with pediatric posterior tibial nerve somatosensory evoked potentials? A, B, or C? This question presents three different posterior tibial nerve somatosensory evoked potential montages. The first montage is the one recommended by the Academy. It consists of 4 derivations. The lower one has the exploring electrode at T12, that is at the level of the spinous process of T12, and the reference electrode at the contralateral iliac crest. This derivation monitors the activity at the caudal equine structure and at the lower spinal cord. The second derivation has exploratory electrode at the level of FPZ and the reference electrode at the level of the fifth cervical spinous process. It monitors P31, which represents a field generated by the nucleus gracilis, and N34, which represents a field generated by according to some, the thalamus, and according to others, the superior colliculi. The third derivation is a bipolar derivation from CPZ to FPC. This derivation monitors P37. P37 reflects the field generated by somatosensory cortex activation. The top derivation consists of an exploratory electrode at the ipsilateral centroparietal region and the reference electrode at the prefrontal sagittal region. This derivation is also bipolar and it monitors P37. The second montage also has 4 channels. The first derivation has an exploratory electrode in the distal popliteal fossa and the reference electrode in the proximal popliteal fossa. In this case, since the stimulation was done on the left ankle, we are talking about the left popliteal fossa. The wave monitored by this derivation is called the PF for popliteal fossa wave. The second derivation connects an exploratory electrode placed at the level of the 12th thoracic vertebral spinous process with a reference electrode at the contralateral iliac crest. It captures a field produced by the cauda equina and the lower spinal cord. This derivation is similar to the first derivation that we talked about when we presented the first montage. The third derivation consists of an exploratory electrode at the midline centroparietal region and a reference electrode at the level of the 5th cervical vertebral spinous process. This derivation monitors the nucleus gracchalis field. And it also monitors the thalamus. As previously mentioned, some authors, based on the preservation of this wave in patients with thalamic lesions, believe that N34 is generated by the superior colliculi and not by the thalamus. It is also worth mentioning that although not used for measuring, this derivation also shows a positive wave following N34, which corresponds to P37. In the fourth derivation, the exploring electrode is kept at the same place as in the prior derivation, but the reference electrode is placed at the sagittal prefrontal region. This derivation captures P37, which corresponds to the somatosensory cortex, that is, to the first activation of the somatosensory cortex, and N45, which is considered a cortical potential related to processing of somatosensory information. The third montage referred to in this question also has 4 derivations. The first derivation consists of an electrode at the distal popliteal fossa referred to an electrode at the proximal popliteal fossa. This derivation monitors the popliteal fossa potential, or N8, to which we have previously referred. PF corresponds to the traveling action potential volley through the posterior tibial nerve going through the popliteal fossa. The second derivation consists of an electrode at the level of the third lumbar spinous process referred to the contralateral iliac crest. This derivation captures 2 potentials, N19, which monitors the volley of action potential traveling through the cauda equina, and a second potential called LP for lumbar potential, or N22. This potential corresponds to an stationary field produced by the activation of the dorsal horn neurons at the lumbar spinal cord. The third derivation consists of an electrode at the level of the second cervical spinous process referred to an electrode 1 to 2 centimeters posterior to the location of the prefrontal sagittal electrode using the 1020 system. This derivation monitors a potential named N29. The putative origin of N29 is the gracilis nucleus. The fourth derivation consists of an exploratory electrode placed 1 to 2 centimeters behind the sagittal central electrode and referred to an electrode placed 1 to 2 centimeters behind FPC. This derivation monitors the clinically important P37, which originates by the activation of the mesial sensory cortex. The second wave monitored by this derivation is N45. The likely origin of this wave is the cortical area surrounding the primary sensory cortex. I know that by now you had enough adult somatosensory evoked potential montages, but I believe there are many more. But I will hold at this point, and I will just end this discussion regarding this question with the following. It seems that the montage that I just showed you is the one that is most often used to compare, or at least to correlate, with pediatric and infant somatosensory evoked potentials. So the answer to this question is C. Next question. Adult nomenclature for posterior tibial nerve somatosensory evoked potential can be adopted at 3 years of age. A true, B false. While talking about the last question, we went through this montage. That is the montage that you're looking at the moment, which, as I told you, is the one most often used to correlate with pediatric studies. I will at this point remove the figure of the adult figurine and bring the figure of a child with a somatosensory evoked potential montage, which, as you can see, has significant similarity with the adult montage that I just showed you before. But still, there are significant differences. To begin with, it has 5 derivations instead of 4. This montage also different from the adult montage regarding the choices of reference electrodes used in most of the derivations. I find it peculiar that the investigator who created this montage used 2 grounds. I do not know if it was intended to be so or if it was a mistake in the preparation of the figure. As you know, it is best to use 1 ground, and it is mandatory to do so if you are not sure if all the grounds are connected if all the grounds that are connected to the patient are going to the same spot being called ground. Leaving that aside, I will call your attention to the first derivation. The exploring electrode is in the popliteal fossa, and the reference electrode at the level of the 6th thoracic vertebral spinous process. The major peak found in this derivation is referred to as N5, which corresponds to PF or N8 in the adult. In the second derivation, connecting an exploring electrode at the level of the 4th lumbar vertebral spinous process to a reference electrode at the level of the 6th thoracic vertebral spinous process, we monitor N11, which corresponds to the adult N19. In the third derivation, connecting the exploring electrode at the level of the 1st lumbovertebral spinous process to a reference electrode at the level of the 6th thoracic vertebral spinous process, we monitor N14, which corresponds to the adult LP or N22. With the fourth derivation, an exploring electrode at the level of the 7th vertebral spinous process connects to an electrode at the mid-frontal region. This derivation monitors N20, which corresponds to the adult N 29. The fifth derivation has an exploring electrode 1 to 2 centimeters behind CC connected to an electrode at the mid-frontal region. This derivation monitors P28, which corresponds to P37, and N41, which corresponds to N45 in the adult. As you can see, the putative origin of these waves are listed above. Now, I have added the figurine of an infant with somatosensory evoked potential electrodes, and in the figure also added are the tracing corresponding to each derivation. As you can see, this montage only has 4 derivations. Notice that the montage is very similar, except that there is no exploring electrode at the level of the 4th lumbar vertebral spinous process. Also, notice that the study was conducted with bilateral stimulation at both ankles. In infants, the label of N5 remains as was used in children, despite that, as we will see in the next few minutes, the timing is different. N16 corresponds to LP, N27 corresponds to N29, P55 corresponds to P37. So the answer to this question is B. Next question. Adult nomenclature for median nerve somatosensory evoked potential can be adopted for pediatric median nerve somatosensory evoked potentials. A true, B false. Median nerve somatosensory evoked potential peak labeling at 8 months is similar to the adult labeling for the most part. N9 corresponds to adult N9. N13 in the cervical derivation to the forehead corresponds to the adult N13. N11 is probably indicative of a bifid peak, a phenomenon quite often observed in infants, or it can also be the consequence of a field created independently in a neighboring structure. P14 captured here in the derivation going from the contralateral centroparietal region to the mastoid corresponds to P13 or 14 in the adult. P14 is also likely to be a brainstem potential. And finally, a bipolar scalp derivation from the contralateral centroparietal region to the sagittal prefrontal region captures N20. So the answer to this question is A. Next question. Which of the following statement is not true regarding median nerve somatosensory evoked potential? A. At 3 years of age, the latency to N20 is shorter than at 18 years of age. B. At 8 months of age, the latency to N9 is the same than at 18 years of age. C. The latency of N13 is longer at 8 months of age than at 3 years of age. D. The interpeak latency from N20 to P23 is shorter at 3 years of age than at 18 years of age. In this frame, I have reintroduced the median nerve somatosensory evoked potential montage previously shown, which corresponds to an 8-month-old infant. Now I have introduced a study using the same montage in a 3-year-old patient. Notice that N9 occurs at about 6 milliseconds after the stimulus. N13 occurs about 9 milliseconds after the stimulus. P14 also occurs at about 9 milliseconds after the stimulus. And N20 occurs at about 17 milliseconds after the stimulus. I have drawn in this frame an arrow going from the stimulus to N20 to emphasize this point. Now I have introduced the same montage used for median nerve somatosensory evoked potential that I have used in the past, but this time it belongs to an 18-year-old patient. Notice that the numerical value of the peaks correspond to the time from the stimulus to the peak. Now I have duplicated the arrow in the top derivation of the 3-year-old onto the top panel, that is derivation of the 18-year-old. I have done so to highlight the difference between the latency of N20 at 3 and 18 years of age. In this new frame, I have removed the arrows going to N20 and introduced instead an arrow going between N20 and P23. Notice that at 3 years of age, it takes about 6 milliseconds for the activity triggered by the median nerve stimulation at the cortex to travel from the initial activated cortical region to the second potential, which corresponds to other cortical area where the information is likely to be processed. It is important here to see that at 18 years of age, it only takes 3 seconds to process that information that took 6 seconds at 3 years of age. So the answer to this question is D. Next question. The shortest latency to N20 median nerve somatosensory evoked potential occurs at 4 years of age. A true, B false. This chart correlates age and latency of different median nerve somatosensory evoked potentials. In this new frame, I am displaying a bipolar scalp recording showing median nerve somatosensory evoked potentials at different ages. As you can see, at 1 month of age, the absolute latency to N20 is about 27 milliseconds. At 3 months, it is about 19 milliseconds. At 4 years of age, it is about 15 milliseconds. At 9 years of age, the absolute latency to N20 remains about 15 milliseconds. But by 18 years of age, it is back to about 18 milliseconds. Notice in the line chart that the shortest latency to N20 occurs at 4 to 5 years of age. So the answer to this question is A. Next question. The shortest N20 to P23 interpeak interval occurs at dash of age. A 1 month, B 3 months, C 2 years, D 4 years. Take a few seconds to analyze this chart. It is the same one that I showed you in the last question. I have added now arrows between the lines of N20 and P23 at the ages listed in the question. You can see that I have done the same in different derivations on the panels to your right. Notice the interval at 9 years and at 4 years. You can see that N20 to P23 interpeak interval are the shortest during these ages. So the answer to this question is D. Next question. Some studies have shown N20 to P23 interpeak latency to be shorter at 12 years of age than at 18 years of age. A true, B false. This frame has the same figure as I've been showing you in the last two questions. Notice that N20 to P23 interpeak latency at 12 years of age and at 18 years of age. As you can see, I have used the same arrow for both. That is, I have used the same side arrow for both, and the one at 18 years of age falls short in comparison to the one at 12 years of age. This is not a significant finding, nor it has been reproduced in other studies, but it seems very cute. So the answer to this question is A. Next question. Which of the following absolute posterior tibial nerve somatosensory evoked potential latencies increases the most from 2 to 7 years of age? A. N5, B. N11, C. N14. This panel has the figure corresponding to a posterior tibial nerve somatosensory evoked potential in a child. The magenta arrow traces the interval between the point of stimulation and the popliteal fossa. Now I have added a chart looking at age in years in relation to latency to N5. N5, as you know, corresponds to the tibial nerve action potential as it crosses the popliteal fossa. Now I have extended two vertical lines to the point of intersection between 2 and 7 years of age and the average N5 latency at these ages. As you can see, the increase between 2 years and 7 years is of 2 milliseconds. This corresponds to an increase in latency of about 33%. Now I am going back to the original figure to do the same process, but now in relation to N14, which corresponds to the potential produced by the activation of the lumbar gray matter. The difference in amplitude between 2 and 7 years of age is 4 milliseconds, which corresponds to an increase of about 27%. Now let's go back to the original figure for a third time to determine the absolute latency to the cervical potential, which corresponds to the activation of the nucleus gracilis. And as you can see, the prolongation of latency between 2 and 7 years of age is 4 milliseconds, which corresponds to an increase of 18%. So the answer to this question is A. Next question. Spinal conduction remains relatively constant from 2 to 8 years of age. A true, B false. The posterior tibial somatosensory evoked potential is the best test to evaluate spinal conduction since it travels from the lumbar to the cervical region. The interpeak latency from the popliteal fossa to the lumbar potential, which primarily represent peripheral conduction, increases by about 3 milliseconds from 2 to 8 years of age. The interpeak latency from the lumbar spine to the cervical spine, which indicates central spinal conduction, only increases by about 1 millisecond during the same time. So the answer to this question is A. Next question. Posterior tibial nerve somatosensory evoked potential N16 and N27 latencies in premature recording decreases with increasing gestational age until full term. A true, B false. This figure depicts the changes in N16 absolute latency that occurs prior to 40 weeks postconceptional age. As you can see, there is a significant drop in N16 absolute latency from 25 weeks postconceptional age to term. The same goes for N27, which, as you can see in this case, monitors cervical potential and includes peripheral and spinal conduction time. So the answer to this question is A. Next question. Serial median nerve somatosensory evoked potential absolute latency to its main component during 33 weeks to 40 weeks postconceptional age shows that myelination and maturational changes in the nervous system outpace linear growth. A true, B false. This frame shows the typical changes in median nerve somatosensory evoked potential occurring from 33 to 41 weeks postconceptional age. At 33 weeks postconceptional age, the main component is sharp, the peak being at about 80 milliseconds after the stimulus. This component evolves into a relatively broad wave at 35 weeks. This wave becomes sharper and the latency is shorter by 37 weeks postconceptional age. And the same trend continues at 39 weeks. At 41 weeks postconceptional age, the main peak is relatively close to what we normally see in infants in the first 3 months of life. In this frame, I have added a yellow line to emphasize the decreasing latency that occurs to the main peak of median nerve somatosensory evoked potential component from prematurity to term. So the answer to this question is A. Next question. During the first year of life, the largest drop in latency of a median nerve somatosensory evoked potential involves A. P22, B. N20, C. N13, D. N12. The peaks listed in the last question are presented in this frame. N12 is likely to represent the traveling wave under the spinous process of the 7th vertebral. N13 likely to result from the cervical dorsal horn and nucleus cuneatus activation. N20 corresponds to the initial activation of cerebral cortex, and P22 to the processing of information at other cortical regions. As you can see, I have introduced a line chart with color match potentials. This chart compares latency of 4 median nerve potential with age. The biggest drop in the first year involves P22, followed by N20, and less so by the spinal potentials. Notice that P22 shortest absolute latency occurs at 6 to 8 years of age. For N20 and N13, the shortest absolute latency is between 2 to 3 years of age. For N12, the lowest latency is a little earlier, between 16 and 22 months of age. So the answer to this question is A. Next question. The latency to N20 is more at 3 years of age than at 18 years of age. A true, B false. In this frame, you can see 3 panels belonging to patients at different ages. I hope you remember it from a few minutes before. Compare the size of the green arrow at 3 years of age and at 18 years of age. So the answer to this question is B. Next question. The N20 to P23 interpeak latency is longest between A. 3 to 8 months, B. 2 to 3 years, C. 4 to 5 years, D. 10 to 12 years. At about 1 month of age, the N20 to P23 interpeak latency is about 10 milliseconds. About 7 milliseconds by 3 months, 5 milliseconds by 4 years, 4 milliseconds by 9 years, and about 3 milliseconds at 18 years of age. I have highlighted now in the linear chart the N20 to P23 interpeak interval at its highest point. So the answer to this question is A. Next question. Which of the following latency is less affected by linear growth? A. P13-14 to N20 interpeak latency, B. N13 to N20 interpeak latency, C. EP to N13 interpeak latency, D. LP to P37 interpeak latency. The spinal interpeak latency is the segment of the posterior tibial nerve somatosensory evoked potential less affected by growth. So the answer to this question is D. Next question. Which of the following is not true? EP absolute latency increases after 2 to 3 years. B. N13 to N20 interpeak latency reaches adult values by 10 years. C. EP to N13 interpeak latency reaches adult value by 14 to 18 years. D. P13-14 to N20 interpeak latency reaches adult value by 18 years. EP or N9 absolute latency increases after 2 to 3 years and continues to do so till about 12 to 18 years, reaching adult values in most individuals by about 14 to 18 years of age. The absolute latency to N13 follows a similar pattern, reaching adult values by 14 to 18 years of age. N13 to N20 interpeak latency reaches adult value by 10 years of age, and it is minimally affected by linear growth. P13-14 to N20 interpeak latency follows the same trend, reaching adult values by 10 years, and is also little affected by linear growth. So the answer to this question is D. Next question. Which of the following is true regarding latency to LP? A. It is about the same at 35 weeks postconceptional age as in adults. B. In individuals born at term, the latency to LP increases from birth up to 14 to 18 years of age. C. It is longer at 25 weeks postconceptional age than at 40 weeks postconceptional age. D. All of the above. This chart depicts the changes in N16 absolute latency that occurs prior to 40 weeks postconceptional age. As you can see, there is a significant drop in the absolute latency from 25 weeks conceptional age to 40 weeks postconceptional age. At about 35 weeks postconceptional age, the absolute latency to posterior tibial nerve somatosensory evoked potential N16 is about 16 milliseconds. That is the same latency as we see in most adults. At birth, LP latency is about 8 milliseconds. At 8 years of age, the average LP latency is about 15 milliseconds, and it continues to increase until 14 to 18 years of age. So the answer to this question is D. Next question. Which of the following is not true regarding central conduction velocity as measured from C6 spinous process to the onset of N20? A. At term, conduction velocity is 8 meters per second. B. At 8 years, conduction velocity is 48 meters per second. C. At birth, conduction velocity is 32 meters per second. D. At birth, conduction velocity is slower than at 8 years of age. Conduction velocity measured from the spinous process of C6 to the onset of N20 is 8 meters per second in a neonate and 48 meters per second at 8 years of age. So the answer to this question is C. Next question. Scalp bipolar recording of posterior tibial nerve somatosensory evoked potential in neonates using CPZ to FPZ derivation and CPC to FPC derivation demonstrates a maximal positive potential at CPC. A. True, B. False. This study was done in a 3-day-old. The derivation used is compatible with the one described or mentioned in the question. The maximal median component is a negative component corresponding to the contralateral centroparietal region. The maximal posterior tibial nerve somatosensory evoked potential component is a positive wave maximal at the sagittal centroparietal region. So the answer to this question is true. Next question. Which of the following is least characteristic of median nerve somatosensory evoked potential in a 2-year-old? A. Bilobe EP, B. Bilobe N11, C. Sharp N20, D. Blunt N20. This is an example of a median nerve somatosensory evoked potential in a 2-year-old. The EP peak is bilobar, and so is the N11, at least sometimes. N20 is usually broad. So the answer to this question is C. Next question. Which of the following is not true regarding somatosensory evoked potential amplitude? A. Cortical potential in infant and children are larger than those in young and middle-aged adults. B. Cortical potentials in young and middle-aged adults are smaller than in persons older than 40. C. Cervical potentials are larger in infants than in children or adults. D. A 60-year-old man somatosensory evoked potential cervical waves amplitude is larger than a 30-year-old man's waves. Cortical somatosensory evoked potential amplitude goes through predictable changes. Cortical potentials are highest during infancy and in children. They decrease in amplitude in young and middle-aged adults and increase in amplitude after 40. The N20 of some octogenarians are 60%, that is just over 60% the amplitude of the N20 of young adults at 24 years of age. I hope you remember this fact by looking at this frame. Cervical potential are highest during infancy than at any other age. They are stable from 10 to 39 years of age and decrease in amplitude after 40. So the answer to this question is D. Next question. Most somatosensory evoked potential studies in adults have documented a drop in peripheral and central conduction velocities with advancing age. True or false? Conduction velocity of the central and peripheral nervous system has been studied extensively. All studies have demonstrated a significant drop in peripheral conduction as the patient gets older. Few studies have found no decrease in central conduction velocity over time, but most have found a significant drop in central conduction velocity over time. From 30 to 70 years of age, central conduction may drop as much as 10 milliseconds. From 50 to 60 years of age, it has been estimated that central conduction drops by about 0.3 milliseconds every year. So the answer to this question is A. Thank you very much for your attention.